Hello, everyone, and welcome back to OET Global Fighters. I hope you're doing well. In today's lesson, we're going to talk about something that I really want every OET candidate to understand before they spend hours and hours practicing writing, and that is the OET Writing Assessment Criteria. Now, I know what you're probably thinking. Okay, I already know the 6 criteria. Maybe you've seen them many times. Purpose, content, conciseness and clarity, genre and style, organization and layout, and language. But knowing the names of the 6 criteria is one thing. Understanding what they actually mean when you're sitting in the exam is something completely different, and that's what we're going to work on today. We're going to take each criterion one at a time, and I'm going to explain it in a practical way. We'll also look at examples from the official OET Writing Guide, because sometimes a simple example makes the whole idea much easier to understand. So grab a cup of coffee if you like. Get your notebook ready, and let's start. Okay, so let's start with the first criterion, purpose. Now, before we talk about the scoring or complicated terminology, let me ask you a very simple question. When somebody receives your letter, why are they receiving it? That's it. That's purpose. The purpose is essentially the reason why you are writing the letter. And according to the OET guide, there are 2 important things we need to think about here. The first is that the purpose should be immediately apparent. And the second is that you need to sufficiently expand that purpose. Now, let's slow down for a moment and think about that first part. Immediately apparent. What does that actually mean? It means that when your reader starts reading your letter, they shouldn't have to search through your first paragraph thinking, why am I receiving this letter? They should understand the reason very quickly. And honestly, that makes perfect sense when you think about real healthcare communication. Imagine you're a doctor working in a busy clinic. You receive a letter. You don't have 10 minutes to read it slowly and discover what the writer wants from you. You want to know, why is this patient being referred? Why has this patient been discharged? Why is this patient being transferred? What does the writer want me to do? So make the purpose clear early. Now, let's look at an example from the OET guide. One of the examples is a referral to an endocrinologist for further management of a patient's blood sugar levels. The guide gives this kind of opening. Thank you for seeing Mrs. Priya Sharma, a type 2 diabetic, for further management of her blood sugar levels. Now, why is that a good opening? Because after reading that sentence, I already know the main reason for the letter. I know the patient. I know the clinical issue, and I know why the specialist is being contacted. There's no mystery. The purpose is clear, but here's where many candidates stop. They write one sentence that tells the reader why they're writing, and then they think, great, purpose done. Not quite. There is a second part. You need to expand the purpose, and this is really important. The OET guide explains that the reader needs more than just a high-level explanation. They need relevant details that help them continue caring for the patient. So let's imagine I say, I am referring Mrs. Sharma for further management of her blood sugar levels. Okay, I understand the purpose, but what does the endocrinologist actually need to know? Well, perhaps the patient's non-fasting blood sugars are around 7 to 8 millimoles per liter, but her fasting levels are regularly above 16. Now suddenly the referral makes much more sense. The purpose has been developed, and that's the important distinction. Make the purpose clear at the beginning, and then give the reader the relevant information that explains and supports that purpose. Purpose is not a template. Now, there's another point from the guide that I really want you to remember. Don't become too dependent on one memorized sentence. I often see candidates who learn, I am writing to refer, and then they try to use it everywhere. But not every OET letter is a referral. Sometimes you're transferring a patient. Sometimes you're discharging a patient. Sometimes you're updating another healthcare professional. Sometimes you're requesting something. The OET guide actually gives several useful verbs: transfer, discharge, update, recommend, see, accept, request, provide. So instead of memorizing one opening, understand the situation. Ask yourself, what am I actually doing with this letter? Am I referring? Am I transferring? Am I discharging? Am I requesting? Once you understand that, the language becomes much easier, and that is a much safer strategy in the exam. Okay, now let's move to the second criterion, content. And this is where I want you to think about one person, not the examiner, not yourself. Think about the reader, because the central question for content is, what does this particular reader need to know? The OET guide explains that your letter should give the reader the information they need to continue caring for the patient and to complete any request you're making. Now, here's the problem. When you look at the case notes, you may see lots and lots of information, and candidates often think everything is in the case notes, so everything must be important. But that's not true. The case notes contain information. Your job is to select the information. Let's take an example. Imagine you're writing to an occupational therapist who is going to receive a patient for rehabilitation. The case notes might tell you about the patient's children, their grandchildren, their previous job, their financial situation, their current abilities, their current limitations. Now ask yourself, does the occupational therapist need to know about the patient's grandchildren? Probably not. Does the occupational therapist need to know what the patient was doing before retirement? Not necessarily. But does the therapist need to know what the patient can and cannot currently do? Absolutely. That's directly related to the care they're going to provide. So here's the question I want you to ask every time you read a case note. Will this information help my reader continue caring for this patient? Right? If the answer is yes, consider including it. If the answer is no, you probably don't need it. Now let's make this slightly more interesting. Imagine exactly the same patient, but now you're writing to their regular GP instead of an occupational therapist. Would you choose exactly the same information? No. And this is one of the most important ideas in OET writing. The same patient can require a completely different letter depending on the reader. The OET guide gives essentially this comparison. If an occupational therapist is receiving a patient for rehabilitation, the letter needs to explain the patient's current abilities and limitations. But if the patient's regular GP is receiving an update, the information needs to be presented as an update from what the GP already knows. So don't ask, what information do I have? Ask, what information does this reader need? That small change in thinking can make a huge difference. There's another side to content, and this one is extremely important. You need to represent the case notes accurately. In other words, when you paraphrase the notes, don't accidentally change the meaning. Let's look at one of the examples in the guide. The case notes say that the patient is moving to Centerville to live with his daughter and her husband. But the letter says that he is relocating to Centerville to be near his daughter and son-in-law. Now, the sentence sounds perfectly grammatical, but there is a problem. Living with his daughter and living near his daughter are not the same thing. One means they're living together. The other means they're simply living nearby. That's a completely different situation. So don't think my grammar is correct, therefore my sentence is correct. No, your grammar can be perfect, and your meaning can still be wrong. That's why you need to check the meaning. There's another excellent example involving medication. The case notes indicate that glipizide 5 milligrams was added to atorvastatin 20 milligrams, with both taken in the morning. But the letter says, glipizide will be added. Now, why is that a problem? Because will be added suggests that the change is going to happen in the future, but the case notes indicate that the medication has already been added. So one small change in tense has changed the clinical meaning. And this is something I want you to be very careful about. When you paraphrase, don't just think about vocabulary. Think about time, meaning, numbers, doses, frequency, and clinical details. Right? Now let's move on. Conciseness and clarity. And I actually like this criterion because it teaches you something very important about OET writing. Sometimes what you leave out is just as important as what you include. Think about that. Content asks, what important information have you included? Conciseness and clarity asks, what unnecessary information have you left out? The OET guide makes exactly this distinction. And at first, some students find that confusing. They say, how can I be assessed on something that isn't there? Well, that's actually the point. If you include too much irrelevant information, the important information becomes harder to find, and healthcare professionals don't have time for that. According to the guide, candidates commonly make 3 mistakes here. First, they include information that the reader already knows, or information outside the scope of the patient's care. Second, they provide too much historical or background detail. And third, they fail to group similar information together. Let's take these one by one. First, information outside the reader's role. For example, the case notes say that Mrs. Sharma felt that the health center wasn't taking her concerns seriously, but you're referring her to an endocrinologist. Does the endocrinologist need to know that? Probably not. It doesn't affect the endocrinologist's assessment or treatment. So, leave it out. Simple. Second, too much history. Imagine the patient has had several consultations over the last few months. You don't necessarily need to describe every single visit. You need to summarize the information that is still relevant to the current situation. The guide gives an example where a patient's injury and the fact that surgery occurred are relevant, but the exact type of surgery isn't necessary for the occupational therapist's ongoing care. So, again, don't copy the case notes, summarize them. Third, grouping information. This one is really useful. Imagine the case notes say, March, patient not compliant with diet. March, patient not compliant with medication. October, medication taken intermittently. October, education provided about adherence. If you simply copy that information in chronological order, your reader may have to piece the story together. Instead, you can bring the related information together. For example, the patient has not been compliant with his diet or medication regimen, with poor memory reported as the main reason for his non-adherence. Much easier to read, much easier to understand, and much more useful to the reader. Okay, let's move to our fourth criterion, genre and style. Now, this is essentially about how your letter sounds and whether the language is appropriate for your reader. Think about this. Would you speak to your consultant in exactly the same way that you speak to your best friend? Obviously not, and your writing should reflect the professional relationship. The OET guide explains that healthcare letters are generally formal, and candidates are expected to use appropriate formal language. Now, formal doesn't mean complicated. That's a very important distinction. Formal doesn't mean, let's use the most complicated vocabulary we possibly can. No, formal means professional, polite, respectful, and appropriate. Let's look at one of the examples. Informal. Thanks for having a look at Priya. Formal. Thank you for seeing Mrs. Priya Sharma. The second version sounds more appropriate for professional communication. Another example, informal. I've sent her to you because she needs to lose some weight. Now, that's not a good way to communicate professionally. A more appropriate version is, I am referring her to you for your specialist advice. Notice the difference. It's professional, it's respectful, and it focuses on the clinical purpose rather than judging the patient. Don't judge the patient. This is another point I really want you to remember. Describe facts, Don't make unnecessary judgments. For example, the guide contrasts Mr. X is a heavy smoker with Mr. X smokes 30 cigarettes a day. Now, which one gives the reader more useful information? The second one, because it's factual. The reader can interpret what 30 cigarettes a day means. You don't need to label the patient as a heavy smoker. The same idea applies to alcohol. Instead of calling someone an alcoholic, you can provide the relevant factual information about their alcohol intake. And instead of saying, she doesn't exercise enough, you can describe what her actual physical activity is. The principle is simple. Give the facts and allow the healthcare professional to interpret them. There's another small but useful point here. In formal writing, avoid contractions. So instead of, he's keen to return home, right, Huff? He is keen to return home. Instead of, she didn't follow the care plan, right? And she did not follow the care plan. The OET guide specifically identifies contractions as informal and recommends avoiding them in this type of writing. Now, this doesn't mean you need to make every sentence complicated. Quite the opposite. Simple and accurate is absolutely fine. And then we have abbreviations. This is another area where you need to think about your reader. For example, an endocrinologist is likely to understand a familiar diabetes-related abbreviation. But if you're writing to a community nurse, you may need to be more careful with abbreviations that could interrupt their reading or create ambiguity. So, again, the question is not, can I use this abbreviation? The question is, will this reader understand it easily? That's the mindset you want. Right. Now let's talk about organization and layout, and I think there's a really nice way to understand this criterion. Think of your letter as the patient's story. Imagine you're handing over a patient to another doctor. You wouldn't just throw 20 unrelated facts at them. You would tell the story in a way that makes sense. You might say, this patient came in with this problem, then this happened. We investigated them. This is what we found, and this is what we need you to do now. That's essentially what you're doing in your OET letter. The guide explains that the order of information should be adjusted according to who you're speaking to and what they need to know. So, don't automatically follow the order of the case notes. The case notes are not your letter. They're your source of information. You decide how to organize that information. Sometimes the best way to organize your letter is chronologically. In other words, you tell the story according to time. What happened first? What happened next? What happened most recently? The guide gives an example involving Mrs. Sharma, where the paragraphs begin with different dates. This creates a clear timeline for the reader, and that can be very useful when the sequence of events is important. But here's the interesting part. You don't always have to organize the letter chronologically. Sometimes a thematic structure is better. That means grouping information according to topic. For example, one paragraph might focus on the patient's diabetes and medication adherence. Another might discuss relevant cardiovascular history. Another might discuss their social circumstances. The guide gives an example involving Mr. Dunbar, where the information is organized thematically according to the purpose of the letter. So ask yourself, what would make this letter easiest for my reader to understand? If that's chronological, use chronological organization. If that's thematic, use thematic organization. There's no need to force every case into the same structure. Now, what about paragraphs? Some candidates become obsessed with having exactly 3 paragraphs, or exactly 4 paragraphs. But the guide makes an important point. There is no fixed limit to the number of paragraphs. Use as many as you need to communicate clearly. Some cases may need fewer, some may need more. The important thing is that each paragraph should have a clear focus. If you've written one enormous paragraph, stop and look at it. Ask, am I talking about one theme here? Or have I mixed 3 or 4 different ideas together? If you've mixed several ideas, maybe it's time to separate them. And organization doesn't stop at paragraphs. Even within a paragraph, the order of your sentences matters. The guide recommends putting the most important information for that paragraph first, followed by supporting information. Think about it this way. Don't hide the most important information in the middle of a long paragraph. Put it where the reader can find it easily. Because remember, you're writing for a busy healthcare professional. You want to make their job easier, right? And finally, we arrive at the sixth criterion, language. This includes grammar, vocabulary, punctuation, and spelling. Now, I want to make one thing very clear. Yes, language is important. Of course it is, but don't make the mistake of thinking, if my grammar is perfect, I'll automatically get a high writing score. No. The OET guide itself reminds candidates that they need to perform well across all the criteria, not simply focus on language. You could have beautiful grammar, but if your purpose isn't clear, that's a problem. You could have excellent vocabulary, but if you've included irrelevant information, that's a problem. You could have accurate spelling, but if your paragraphs are badly organized, that's a problem. So think about language as one part of the complete picture. Let's start with grammar. You need grammar that allows you to communicate your meaning accurately. You don't need to show off. You don't need to use complicated structures in every sentence. Instead, focus on accuracy. Make sure your tense is correct. Make sure your subject and verb agree. Make sure your sentences are complete. And make sure your grammar doesn't change the meaning of the case notes. Remember the medication example we discussed earlier? The problem wasn't that the sentence was grammatically terrible. Actually, it was grammatically fine. The problem was that the tense changed the meaning. So, grammar isn't just about avoiding mistakes, it's about communicating the correct meaning. Now, let's talk about vocabulary. Medical vocabulary is obviously important in OET, but again, don't make your writing unnecessarily complicated. Choose vocabulary that is accurate, appropriate, and clear to your reader, and pay particular attention to medication names and other clinical terms. The OET guide specifically highlights vocabulary as an important part of communicating with the audience in writing and speaking. So if you know the correct medical term, use it. But don't replace a simple, accurate word with a complicated word just because you think it sounds more advanced, right? And then we have punctuation. Now, punctuation might seem like a small thing, but it can actually make your writing much easier to understand. A comma in the wrong place, or a very long sentence without proper punctuation, can make the reader work harder. The guide points out that punctuation adds clarity and helps communicate your message to the reader. So when you're checking your letter, don't only check grammar, look at your punctuation too. And finally, spelling. Obviously, you want your spelling to be accurate, especially with medication names, medical conditions, names, and important clinical terminology. But don't panic if you occasionally make a small spelling mistake. The OET guide notes that you don't need to be absolutely perfect to achieve a B. The goal is accurate communication. Okay, so we've now gone through all 6 criteria, but here's where I want to bring everything together. Because in the actual exam, you don't have 6 separate brains. You're writing one letter, and all 6 criteria work together. So let's imagine you've just finished your OET letter. You've got a few minutes left. What should you do? Don't just sit there thinking, okay, I'm finished. Use those final minutes. Become the reader. Pretend you're the healthcare professional who has just received your letter, and ask yourself, why am I receiving this letter? Is the purpose obvious? Then ask, do I have everything I need to continue caring for this patient? That's content. Then, have I included anything unnecessary? That's conciseness and clarity. Then, does this sound professional, respectful, and appropriate for me as the reader? That's genre and style. Then, can I easily follow the patient's story? That's organization and layout. And finally, is the language accurate and clear? That's language. Now, if you can look at your letter from that perspective, you're doing something much more valuable than simply checking grammar. You're actually checking the way the examiner is assessing your writing. So let's take a breath and summarize. The 6 criteria are not 6 completely separate rules. There are 6 different ways of asking one bigger question. Can this healthcare professional understand the situation and know what they need to do next? Purpose asks, why am I writing? Content asks, what does the reader need to know? Conciseness and clarity asks, have I removed what they don't need? Genre and style asks, am I communicating professionally and appropriately? Organization and layout asks, have I presented the information in a logical, easy to follow way? And language asks, is my English accurate and clear enough to communicate the message? That's the big picture. And once you understand that, OET writing becomes much less about memorizing templates and much more about communicating effectively. So the next time you open an OET case note, don't immediately start looking for a template. Pause. Look at the reader, look at the purpose, look at the information, and ask yourself, if I were the healthcare professional receiving this letter, what would I actually need to know? That question can guide almost everything you do. And remember, the patient in every OET task is different. The reader is different. The purpose is different. So your letter should be personalized to that situation rather than being a memorized letter with the patient's name changed. Every patient has a unique situation, and therefore the purpose of each letter needs to be personalized. So understand the case, understand the reader, choose the right information, organize it logically, and communicate it clearly. That's what good OET writing is about. Right? Thank you very much for joining me today. I hope this lesson has made the 6 assessment criteria a little clearer. And more importantly, I hope you now understand how to think about them when you're actually writing. Keep practicing, keep reviewing your mistakes, and don't just ask yourself whether your English is correct. Ask yourself, would this letter genuinely help my reader? If the answer is yes, you're heading in the right direction. Thank you for watching OET Global Fighters. Don't forget to subscribe for more lectures. See you in the next video.